Hi, my name is Eric Bell. I'm currently a licensed registered nurse working in the Cambridge, Massachusetts area. I'm also a BSN candidate at the University of Massachusetts, Boston. Today I'm here to discuss some topics concerning Alzheimer's disease. I'm joined here by Dr. Paul Rea, who's dedicated many years of his life to the area of Alzheimer's research. Thank you for being here with us today, Dr.
My
Rea.
pleasure.
Would you like to introduce yourself? Tell us a little bit about how you got involved in Alzheimer's research.
I've always had an interest in geriatrics and got involved in my educational program in psychology, but devoted my studies to gerontology. And I had several relatives that had Alzheimer's, and that kind of sparked my interest in what was actually going on then. And this was many years ago, before we really knew much. And in those days, it was called senile dementia. And so that's what got me interested in the field, is because of a personal relationship, both as a family member and caregiver. So I have been working with the Alzheimer's Association for over 30 years.
I mean, when we talk about Alzheimer's disease, I know there's a lot of different treatments that have been tried out in the past. And I know that as far as Alzheimer's disease, it seems like it's an intimidating disease to be approached with a diagnosis of. If we could talk about just the benefits of like an early diagnosis and how important that is to the quality of life for the person being diagnosed, as well as the caregivers.
Sure. I think it's important first to sort of distinguish some of the terms. Dementia is a catch-all term, and it refers to a cognitive deficit. And it's a condition. And there are many diseases, one of which is Alzheimer's, that can cause the condition of dementia. So Alzheimer's is the most common form of dementia. There are 5 million people in the United States with dementia. There's 10% of those people between the ages of 65 and 74 who have Alzheimer's, 20% between 75 and 84, and almost 50% of those over 85. It's not normal aging. It is distinctly a disease. It is a terminal illness. And certainly the specter of Alzheimer's haunts most people who are over a certain age. But it's important to note that the disease itself, the disease process, the neuropathology of the disease starts 10, 15, sometimes even 20 years prior to your noticing symptoms. I think the person with Alzheimer's notices those symptoms fairly early, but they don't make a huge difference in the way the person interacts on a daily basis. So families don't see the disease very early. It is becoming ever more evident that an early diagnosis is extremely important. The statistics on diagnosis are startling, in that only 50% of the people who actually have Alzheimer's disease ever get diagnosed. And of those 50% who are diagnosed, they're diagnosed very late in the disease. And African Americans have even less of a percentage of diagnosis, and they're diagnosed 7 years later on average than Caucasian population.
Now, are these individuals misdiagnosed, or are they for something else?
They don't bring their symptoms to their doctor.
Do you think it's out of fear for loss of independence?
I think it's out of fear. And the families will see something, and they misidentify what the person is experiencing as normal aging.
Okay.
And it can go for years as it's just normal aging. She's just getting older. But it's a disease. and it's a terminal disease. So what we're finding out now in most of the ongoing research is that if you diagnose it early in the process, there are things you can do to delay the progression of the disease, or in some cases, perhaps to prevent symptoms associated with the disease. So early diagnosis is really important. To take your complaints to the doctor. Sometimes it's the family that need to contact the doctor and say, this is what we're seeing in our relative. And have the physician follow up with a battery of tests, usually that will involve a complete medical evaluation, neuropsychological testing, and brain scanning.
How often should that be done? I mean, I know that it's expensive and that maybe insurance companies don't want to cover the cost of doing maybe a brain scan annually, but do you recommend that brain scans should be done annually, or cognitive screening should be done every 4, 6, 12 months?
Yeah, I don't think brain scans need to be done on a regular basis, but only once you're noticing something wrong. But you probably want to get cognitive screening on a regular basis and be very mindful of your ability to organize a task, your memory. And as anyone gets older, yes, you might forget where you put your keys or forget where you parked your car. But when you start seeing a pattern, even a subtle pattern, that should be brought to the attention of your doctor. If the family sees that pattern, they should talk to the person, their loved one, and then also talk to the doctor about it. The earlier someone is diagnosed, the better the chances are that we can minimize the symptoms associated with the disease and slow everything down. There are lots of drugs out there now that are being looked at whose purpose will be exactly that. You want to give it to someone in early stages of the disease, and it will prevent the disease, hopefully. There's no medication being tried now that if you give it to the person will restore the person to the way they were.
I know you were talking about earlier one of the therapies that you've created. How important is that to the field of Alzheimer's research moving forward?
Yeah, some colleagues developed a technique called habilitation therapy. And it's not rehabilitation therapy. We can't restore what was lost. But what we can do is slow the progression. We can minimize symptoms. We can give the person who's living with the disease a higher quality of life. And we just published an article in a prominent Alzheimer's journal, peer-reviewed journal, that showed that we had effectively reduced the need for lots of medication that folks were taking, and that we dramatically improved their quality of life and reduced many symptoms associated with the disease. The premise of habilitation therapy is that the last part of the brain to be engaged by the pathology of the disease is the amygdala. And the amygdala is a part of the brain that controls emotions, basic emotions. And the basic goal of habilitation therapy is to bring about a positive emotion and to maintain that positive emotion over the course of the day. And that sounds simplistic, but in actual clinical practice, it's kind of hard to do. So it takes a lot of training with caregivers, family caregivers, professional caregivers, to give them the skills and the techniques that we've developed so that they can do that.
I know we talked about too, as far as like therapy is concerned, moving forward. I know that a lot of what I hear from people is the loss of independence, the fear of loss of independence, and the fear of being institutionalized. I know that you can afford people these therapies while they're maybe at an inpatient facility, but as far as applying this therapy to an outpatient setting, support groups, how would we go about that?
And that's exactly where it needs to be applied, is
Okay.
to folks living in the community. Because that's where it's going to be the most effective. So we've, at the Alzheimer's Association, we've had for years now training programs for caregivers, for family caregivers, teaching them the skills of habilitation therapy. I started the first support group in the country in 1987 for early stage patients. And that's proven to be a very effective model. Of course, the Alzheimer's Association has had for years now support groups for caregivers. And you can learn a lot of the coping strategies through the support groups. But there are programs that will teach you the communication skills, how to set up your personal home environment that will best serve the person with dementia, how to keep the person engaged in community-based activities, in family-based activities, which is probably one of the best things we can do. It's the motor that drives the habilitation therapy model, engagement, and how we deliver personal care and how we troubleshoot behaviors. Those are all things we teach caregivers, family caregivers to do, as well as professional caregivers.
How often, like weekly, right? So if you were to break it down into numbers, how many days a week do you think that somebody should be out and about socializing with their peers, maybe at a memory cafe or as a part of therapy?
At least 3 or 4 times
Okay.
at a minimum per week. It's not only being engaged in outside activities, but it's also feeling that you still have a purposeful role in your home. So that if the person in mid-stage disease used to be a wonderful apple pie maker, the caregivers can sit with the person and work with them and make that apple pie and sort of be their memory and be their guide. But to have a purposeful role within the family, that's important.
Is there a time, or as far as the nature of the disease being progressive, is there a time at which you would have to think about moving yourself out of the community setting?
Sometimes, yes. It really depends on what kind of safety issues may be an issue, or the kinds of care hours of care provision that are available. Some folks were going to have to consider some other kind of care, but there are now so many options, and one of the things I want to stress is that the Council on Aging is a wonderful place to go and get some of those find out about the resources that are available while you're still living in the community, and to find out some of the resources that you might want to investigate for if you need it down the road. And one of the things we always talk about is preparation, that the family should very early on, anyone who's older should do this, is connect with an elder law attorney and set up a living will, set up a durable power of attorney, set up a will, and have all your affairs put in order. This should be done for anyone who's older. But it's a good place to start, that the family knows, particularly if in the case of dementia, who's going to be making decisions. So the person with the disease can, in the early stages of their disease, say what they want for the future. They can appoint the people who are going to make health care decisions for them, or financial decisions for them. And to have, I'm a real advocate of having regular family conversations so that the family gets together in the beginning and says, we've been looking at mom's behavior. Have you seen what I see? So that they get consensus that they're all seeing the same thing. And maybe they then take that information and take it to mom and say, this is what we are seeing. Are you feeling the same thing? And then having another conversation where you talk about going to the doctor and expressing these symptoms. And they're stressing that there's a lot of hope here, that there are things that you can do, even if it is Alzheimer's disease, that will slow things down. In many cases, when you go to the physician with some of these complaints, it's actually a medical issue that is causing some memory loss, that is causing some cognitive decline. And there are addressable medical strategies that can reduce that. In the case where it is Alzheimer's or some other related form of dementia, and I should mention at this point that dementia is a catch-all term. It refers to memory loss, confusion, and disorientation. And it's like saying someone is blind. It describes the condition. There are many diseases that can cause the condition of dementia. Alzheimer's is the most common form of dementia, affecting over 5 million people in the United States, 120,000 people in Massachusetts. It's the 5th leading cause of death amongst elders. And it is a growing problem in the sense that as the baby boomers age, we are going to be seeing more and more people with this disease. So the key point is identifying it early, facing it, and getting to the Alzheimer's Association, getting to treatment, medical treatment, where it can be diagnosed and acknowledged.
Are there some modifiable risk factors that people can look at and kind of take care of that are linked to?
Yeah. Let me go through what
Alzheimer's
the risk factors are.
Okay.
The first one is age.
Okay.
The older you get, the more likely you are to get dementia. But it's not normal aging. That's what I want to stress.
Okay.
It's not normal aging. It is a disease. Can't do anything about that. The next one is genes. And there are 22 known genes associated with Alzheimer's. Some have more risk factor associated with them than others. And those genes can be identified at this point. You can actually go and get a test and see if you carry any combination of these 22 genes.
Well, what is the benefit of that? If you're gonna know that you are at a higher risk, how would you kind of
that's a good question.
circumvent that so that you aren't
What's the
lessen
benefit
the risk?
to knowing at 25 years old, getting a genetic test that's going to tell you that you're very likely to get this disease at 60?
Because that's a big hit, right? That would.
That's an emotional issue.
Yeah, exactly.
But what we know now is, if I go through some of the other risk factors, you'll see you can possibly prevent the disease. Next risk factor is cardiovascular disease.
Okay.
So if you address cardiovascular disease, you can possibly avert getting Alzheimer's disease. The next risk factor is diabetes. And again, if you can avoid diabetes or manage your diabetes in a successful way, you can dramatically reduce your chances of getting Alzheimer's disease.
Okay.
Another one is prolonged depression or stress. Again, if you can change your lifestyle so that you're not experiencing prolonged stress, that will reduce your risk factors. Head injury is another risk factor.
So there are a lot of modifiable risk factors that we can take into account that we can say, all right, if we take care of A, B, and C, we might lessen our.
So if you get, it's very difficult sometimes to organize getting a genetic test, but if you get early identification, where you get a family history or a genetic testing done, not only do you have the opportunity to reduce your risk factors for the disease. But you put yourself in a position so that the most likely thing to happen is we're going to develop a medication that we would give to people who are at a known risk. And we would give them that medication to prevent the disease. So by identifying yourself or by getting diagnosed very early in the course of your disease, remember, Alzheimer's disease can go anywhere from 2 to 25 years. So by getting diagnosed early, you also put yourself in a position where you're more likely to benefit from the medications that are currently available, as well as the medications that will soon be available in the next few years.
That's good to know for people tuning in at home. I think we were going to talk. I wanted to talk about some of the. So, for people who want to find out more information about Alzheimer's disease, about dementia, or let's specifically say, let's just focus on Alzheimer's disease. What types of maybe websites or journals or articles that they can kind of look towards that give them good information?
Right. There are lots of resources out there now. Certainly, let's divide the knowledge base into learning more about the disease,
Yes.
learning more about resources that can help you at various phases of the disease, both the person with the disease and the family or caregivers for that person. If you contact the Alzheimer's Association or go to the Alzheimer's website, they have links to all kinds of information about the disease itself, about the symptoms and the risk factors and the research that's going on. All kinds of information is available. And that information is not only available to read, but it's also been recorded so you could listen to it. So if the person has a visual disability or the person just wants to put something in their car on the way to work, they can actually download information and listen to it as well at the Alzheimer's Association. Another resource is the Council on Aging, to learn about services that can benefit the individuals with the disease and the family caregivers. Still another resource is the Minuteman home care system. And they have a information line that can link you up to all kinds of services that will bring service into the home or alert you about services that you could purchase or alert you about services that are best suited for dealing with Alzheimer's. So you've got really 3 good resource spaces: the Alzheimer's Association, the Council on Aging, and Minuteman Senior Services.
Awesome. I think that having the availability of resources as well as the Council of Aging on Aging is a great resource for the community setting. I don't know if many people know about it, so that's why we're here trying to discuss Alzheimer's disease and the services that are provided in the community setting by the Council on Aging. Is there anything else you wanted to add?
Well, if families, caring for people with Alzheimer's is a difficult task, particularly as the disease progresses. And I want to stress one thing here, that it isn't that one person in the family gets Alzheimer's. Once the diagnosis is made, an entire family gets Alzheimer's. And they're all going to suffer the stresses and strains and experience some of the joys that can happen with this disease as well. So I want to have people see this as a family disease so that the caregivers need treatment just as much as the person with the disease. Reducing caregiver stress is extremely important so that the caregiver can be in there for the long run. One of the things we see is that caregivers suffer from depression and a high degree of stress. Their blood pressure goes up, and it increases their risk factors for sudden death. So caring for the caregiver is just as important in terms of caring for the person with the disease. So the Council on Aging is a place where some of that care can take place. Respite or time away for the caregiver is essential. And all the research shows that a caregiver in mid-stage, caring for someone in mid-stage Alzheimer's needs at least a minimum of 4 hours a week of predictable that they can rely on. On Saturday, the kids are coming over to take care of Dad, and that's going to happen every Saturday. Or I have a home health aide coming in for so many hours a day. Or Dad's going to an adult day health center for so many hours a week. To have at minimum 4 hours of predictable respite care is absolutely required for folks giving care to those with Alzheimer's. So we have to stress this isn't just a disease for the person, it's a disease that is affecting the whole family, even children, young children. I had a support group that ran in Arlington at First Parish Church for years for children aged 7 to 12. They had grandparents living in their home who had Alzheimer's disease. Now, a lot of those services are available through the schools, but we ran support groups for 12 years for young children. And a resource that you can connect with through the Alzheimer's Association for children is a video called Someone I Love Has Alzheimer's. Someone I Love Has Alzheimer's. And it's specifically produced for children. There's an accompanying workbook for children, young children who have grandparents or even in some cases parents with the disease. So I want to make sure that people understand this is a family illness, and there are services for the entire family that are available.
Yeah, it's important to take care of yourself, especially if you're dealing with a disease such as Alzheimer's.
Yeah.
That in the progressiveness of the disease, you can become quite burnt out. I mean, dealing with somebody who has Alzheimer's disease, it's a kind of a new hurdle every day.
Yeah.
So it's good to take care of yourself if you are the caregiver or the sole caregiver, and to reach out for help if you need some. I think we're running out of time, so I think this is going to be it today. But if you want more information regarding Alzheimer's research or support services in your community, you can contact the Arlington Council on Aging. We're located off 27 Maple Street in the Senior Center. You can find our website; it should be listed below. And you can look for more information. Social opportunities in your community are granted or afforded to you over at the Senior Center. So come on down and check it out. Thank you very much for talking with us today, Dr.
My
Ray.
pleasure.
It's been a pleasure. Thank you.